Hi, I'm Davinder Singh. I'm a pediatric plastic surgeon at Phoenix Children's Hospital. I am the division chief of pediatric plastic surgery, and we take care of children with all sorts of conditions. So, plastic surgery is unique in that we operate from the head all the way down to the toes. Within plastic surgery, we have different types of specialties. My specialty is in cleft and craniofacial, so I repair a lot of birth anomalies, children who are born with cleft lip and palate or an abnormal head shape where their brain doesn't have enough room to grow, and we need to increase the size of their head to allow for their brain to grow. So a typical day for us in plastic surgery involves seeing patients in clinic. It's a particular joy because we also get to meet the parents and spend time with the entire family, getting to know them, getting to know what their needs are. And then we also spend time in surgery. Some days we generally have 2 to 3 surgeries a day, depending on how long each surgery is. My patients are really my extended family. I think that there are a lot of different skills being a physician requires, especially being a surgeon. In plastic surgery, we're oftentimes faced with a problem and we have to use a set of principles, a set of guidelines, and knowledge of anatomy and physiology and science and math to figure out how do we solve this problem. A child comes in from a car accident and has missing tissue. So how do we restore that? How do we restore the child's face or the child's arm? And having that vision of art and how things fit together and how the human body is made helps us to restore that form to the human body, to the injured child, or to the child who's born without a hand or without a part of their face. I think one of the big things I've realized over the years, and I think one other reason I was really drawn into medicine is because of the importance of communication and of collaboration. The reason I settled on medicine is because I felt like it really blended all of the skills and all of the subjects I loved in middle school and in grade school and even in high school and college. And that's communication, speaking, collaborating, having leadership skills to know how to put the team together and have the team function to be able to help patients. I think because I was instilled with such a desire to learn from my parents and be open-minded, I think I loved everything. There was nothing that I said, oh, I can rule that out. I don't want to do that. And so when I went to college, I took classes across every subject. And it was really between sophomore and junior year that I had somewhat of that aha moment. I found myself gravitating towards doing volunteer work with children. I did something called Youth Together where we tutored city children in middle school and in high school for academic subjects and also mentored them. And so I had a student who was with me from freshman through senior year. She actually was the one who got me involved in volunteering at a hospital because she was volunteering at a hospital. And I think that was my aha moment. I thought, I love teaching, I love working with children, and I love being in the healthcare setting. And I realized how much, we were all using our collaboration and communication skills in doing these projects and in doing volunteer work. And I thought, if this can be my everyday life, this would be great.